Welcome, Brett. Thanks for joining me.
Thank you, Susie. I'm really happy to be here.
Well, health savings accounts, or HSAs, are a type of tax advantage account that can be used to pay for qualified medical expenses. But there's a lot to know about these accounts and how they work. Can you give us an overview?
Sure. Well, an HSA, as you mentioned, is a tax-efficient account which allows customers to save and pay for qualified medical expenses. If you are enrolled in a high-deductible health plan, you are eligible to contribute to them. The accounts have a unique triple tax benefit. First, you can contribute to the account on a pre-tax basis, which would lower your taxable income. Second, the earnings accrue on a tax-deferred basis. And then when you withdraw the funds, assuming it is for a qualified medical expense, that is also tax-free. No other account has those three benefits. That is unique to HSAs. Now, there are limits in terms of the amount you can contribute each year. The IRS sets those. This year, 2025, it is $4,300 for an individual account, $8,550 for a family account. The IRS does adjust those limits annually. For 2026, the individual limit will be going up $100. For the family account, it will be going up. These accounts are also flexible. When you contribute to the account, those dollars are yours to use for saving and paying for expenses. Also, it's portable, meaning they will be able to stay with you even if you change your health plan, you change your employer, or you retire.
Well, triple tax advantaged, flexible, and portable. Great. We know that HSA use has been steadily increasing. Could you explain who should consider an HSA?
Yes, so if you have enrolled in a high deductible health plan, you are not signed up for Medicare, and you are not claimed as a dependent on someone else's tax return, you are good to go. Now, a lot of people will ask, what is a high deductible health plan? And this is a plan that is defined by the IRS based on the deductible and the out-of-pocket maximum. A lot of people tend to shy away from these high deductible plans because they believe them to be more expensive. But those plans often come with lower monthly premiums. And I'd encourage you to run those numbers, look at the plans available to you, look at the way your family uses healthcare.
Lots of people who may be eligible for an HSA still don't have one. So let's talk about why that might be the case. What are some common myths or misconceptions that may be holding people back?
So there are a lot of myths and misconceptions with HSAs. The first one, the one we hear most commonly, is the confusion between an FSA and an HSA. They sound the same, they're both used for qualified medical expenses, but the accounts are really quite different. The FSA is used only for a single year, and those funds can't be invested. An HSA can be used to save for retirement, and those funds can be invested for the future. Another misconception or myth that we hear is that it's just too late to start saving through an HSA. But as I mentioned earlier, the eligibility is based on your health plan, not your age. So at age 55, you actually have an added benefit, which is the ability to make $1,000 annual catch-up contribution to your HSA on top of the limits that I also mentioned. If you started at age 55, invested to your individual maximum, made your catch-up contributions each year, you would be able to accrue as much as $80,000 or more in retirement for your qualified medical expenses. Another misconception that we hear is that you can only sign up for your HSA through your employer. That is not true. You can sign up directly for an HSA through a number of financial institutions, and there are good reasons for maybe wanting to do that. The plans are quite different in terms of the account fees, the range of investment options that are available, as well as the minimum that's required before you can invest, and the rate that is paid on your cash balance. And then a final concern that we hear is around overfunding their HSA. Customers are sometimes concerned that they will not have enough in medical expenses to justify the withdrawals. But with an HSA, you have an added benefit, which is that after age 65, you can withdraw those funds for any reason And that would be penalty-free, though you will need to pay tax on those withdrawals at the ordinary income rate.
You mentioned using an HSA in retirement, so let's talk more about that. What are some ways an HSA can help you manage healthcare expenses later in life?
Yes, so one of the concerns that we hear from customers and why they might not want to sign up for an HSA is they believe that once they're covered by Medicare, they're not going to have other medical expenses. But the truth is that based on the analysis that we've done, even if you are covered by Medicare, the expenses that you will incur to cover your healthcare expenses from age 65 and beyond are about $172,500 on average. Those expenses could include your deductible, your copay, your prescription drug expenses. So an HSA can be used to cover those expenses as well as many other expenses related to Medicare. Though you can't use it for a traditional health plan, you can use it to cover your premiums for Medicare Part A, Part B, Part D, Medicare Advantage, some qualified long-term care plans. Watch out, though, you cannot use it for Medicare supplement plans, so that's something to keep in mind.
Clearly, an HSA has the potential to be a beneficial option for savings. Can you share some strategies to make the most of your HSA?
Yes. So when we speak with customers and survey them, we have found that those customers who are signed up for an HSA, only 3 in 10 have those funds invested. So consider investing those funds. One strategy that customers should consider is instead of withdrawing from their HSA to cover their qualified expense in the current year, stay invested in their HSA and then hold on to the receipts, and they can use those receipts to justify a withdrawal in a future year. When we think about other tips, family coverage is an important topic. We mentioned earlier the catch-up contribution that customers can make at age 55 and beyond. What I didn't mention then is that your spouse is also eligible for that annual catch-up contribution. They would just need to make that contribution in a separate HSA. And then this last one is one of my favorites because I have kids in this age range. But if you have a child, they are on your high deductible health plan, they're not still claimed as a dependent on your taxes, they can contribute in their own HSA up to their family maximum. That is a real advantage for children who are starting out and saving for retirement.
Well, Brett, this is so much fantastic information. Thank you very much.
You're welcome.
If you have questions about health savings accounts or planning for your healthcare expenses in retirement, reach out to your Fidelity representative. If you don't have a Fidelity representative, visit fidelity.com/findinadvisor. And for more timely news and thinking from Fidelity's top thought leaders, subscribe to Insights from Fidelity Wealth Management. I'm Susie Allen. Join me again soon.